The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Thank you for attending the webinar this morning, and I hope all is going well for you and you're staying well. Today we have a team from the Community Services Division that's going to give information about the programs that are a part of the Community Services Division. In case you're wondering whether you're in the right spot, this is the Division of Behavioral Health and Recovery Topical Employment webinar for the month of April. And we will be sending out the recording and the slides after the fact, so just so that you know that. With that, I'm going to turn it over to Nick, and I'm not certain I know how to say your last name, so I'll let you do that, Nick, in order to start the presentation. Thank you.
Great, thanks, Dawn. You all can hear me, yes?
Yes.
Okay, thanks. So welcome everybody. My name is Nicholas Wyatkowski. I'm a program manager with the Community Services Division, and I work specifically with our social services programs. I've been with the division, 7 years. And prior to working with this division, I worked briefly with Children's Administration, and I worked several years in the nonprofit world, primarily doing street outreach and homeless advocacy and emergency shelter work. And Yvette and Sarah are joining me today, and I'll let them jump in real quick and just introduce themselves before we move ahead. So yeah, whoever wants to jump in first.
Hi, this is Sarah Garcia. I am also a program manager with the Community Services Division. I've been with CSD for just over 20 years, most of that in the field doing the issuing benefits in the Work First program. And I have been with headquarters for about 3 years now in the TANF Work First program. And we're happy to be here today.
Hi, my name is Yvette Donez Figueroa. I work with the Community Services Division. I am a food policy program manager. So I'm responsible for the statewide policy development and implementation of the federal and state food programs. I've worked for the state for approximately 11 years, almost 12. I started out at Capitol Hill Community Service Office. While there, I did work at Harborview Medical Center and did some interning at Downtown Emergency Services Center doing mental health evaluations. So that was a great experience for me. So I've been with the headquarters for about a year, so I think I'm the newest, but been working for about 12.
Great, thanks. And also, I don't know if we need to do any housekeeping, and feel free to chime in, Dawn, if you want to. There is a chat feature that you can use if you have questions. We'll have time for questions at the end, but we'll kind of be going through different programs throughout the presentation. So Dawn, if there's questions that pop up that are sort of pertaining to the program area that we're covering in the moment, feel free to let us know if that, for flow, if that seems better. I'm open to, doing questions throughout. We'll also have time at the end, like I said. So
Okay.
moving on. Okay. Do folks know how to do a chat? Should we mention how to do that, or is it pretty self-explanatory?
There are a couple of options. You can raise your hand or use the chat box. If you have a small window on the right side of your computer and you look at the very bottom of the list, it says chat. And if you click on the arrow there, it will open up the chat box.
Awesome. So yeah, feel free to interrupt us, Don, if you get any questions from the audience. So today we just have a couple simple objectives, but we'll be going into more detail about those. So essentially, we want to kind of give a brief overview of some of our hallmark programs. We have a lot of programs. We're not going to cover all of them, just a handful of them today. Our cash programs and basic food are the main ones. We have intersection with medical and childcare subsidy, but we will talk in detail about those. And then also just how and when to access services. There's a few different points to do that, and then we'll probably sprinkle in some updates and changes related to the COVID pandemic, because our service delivery and our policies and procedures have been rapidly changing throughout this time with the public health crisis. So, and without further ado, I will hand it over to Sarah to give a brief overview on the TANF program.
Well, okay, thank you. So we're going to start with the cash programs, and I'm going to tell you a little bit about the TANF Cash Assistance Program, Temporary Assistance for Needy Families. It's a program that provides some temporary cash for families in need. Some families will be participating in a Work First program, which helps participants find and keep jobs. The TANF household includes two-parent or single-parent households, pregnant women with no other children in the home, and also relatives caring for a minor child, such as like a grandparent, grandchildren, nieces, nephews, unrelated adults can also receive cash assistance in the place of a parent. Recipients of TANF also receive medical assistance. TANF grants are based on the family size and income. And then alternatively, persons who care for a relative's child or legal guardians or act in the place of the child can also apply for cash on behalf of themselves or just the children. They're getting a cash grant for just the children. We typically call it a non-needy relative or a local parentis or a legal guardian. The parent applying income, the non-parent, we don't look at their income or resources when we're determining the cash grant in those cases when they're getting the grant just for the kids. If a household's found eligible for the TANF program, the recipient must cooperate with the Division of Child Support and participate in the Work First program if it's required. It is important to note that TANF families are limited to 60 months on benefits in their lifetime unless they qualify for a TANF time limit extension. And we're going to dive into that a little bit later when we're talking about the changes that we've made to kind of combat the COVID pandemic. Right now, we're offering extensions to anyone because it's hard to find work right now under the circumstances. So we'll go into a little bit more about that later. The Work First program assists recipients by helping pay for childcare expenses through the Child Care Subsidy Program. We can help with job search activities, including resume writing, job interviewing skills. We also provide opportunities to get training to increase skills to get a better job. So people might be able to work on their GED or high school diploma or some sort of vocational training. We can also do support services to help folks participate in their activities or to get or keep a job. So it could be things like clothing to look for work, or if you find a job, clothing or tools you might need for that new job. We can help with gas, vehicle repair, even relocation expenses to move someone to a new job. So I also want to talk about the Diversion Cash Assistance Program. It provides assistance for families who meet the TANF income limits when they apply. They're under the income and resource limits, but they really only need temporary help, just a one-time help to keep them from having to come on cash assistance, the monthly cash grant. It's help up to $1,250 based on the need of the family to pay for things like rent, utilities, transportation for work, that kind of thing, so that we're able to help the family kind of get to where they need to be. And then the expectation is that they would be able to stay off cash assistance for 12 months after that with that one-time assistance. And there is no requirement to cooperate with the Division of Child Support or to participate in the Work First program with the diversion cash assistance. But if someone gets the diversion and they do come back on TANF within 12 months, they'd have to pay back a prorated amount of that of the diversion grant that they received.
We do have a question. It says 60-month, who is this to? Who is it, the parent or the children? How do young children get help if parent with their TANF with an older child?
So the is for the adults only. The minor children who are dependents on the case, we're not looking at them. So yes, potentially a child could be with the parents for 60 months, and then if the child ends up moving in with a grandparent, the grandparent could then get a cash grant because we're not looking at a time limit for the kids. Did I answer that question? Does that make sense? And yeah, please feel free to reach out with any other questions as I go along. I'm just kind of just speed running through that. And then finally, the state family assistance is actually pretty identical to the TANF program. It's just for folks in Washington who are ineligible for the TANF program, mostly due to citizenship status or immigration status. So it mirrors all the TANF income, resource limits, and workforce requirements. Any other questions about the TANF workforce diversion or state family assistance before we move on to the next slide?
I see that Malia has her hand raised, and so I'm going to attempt to unmute her. Malia, you should be unmuted. Do you still have a question? Malia? All right, let's go ahead and go on. Malia, you might want to type your question into the chat box.
Okay, and yeah, and we can revisit anything that you have as we move along as well. So another program we thought we'd tell you about is for folks who are on TANF but have some emergency housing or utility needs. We call it Additional Requirement Emergent Need, or AREN. Benefits may be authorized multiple times in a consecutive 12-month period, but the total annual amount can't exceed $750. The payments are made to be used to prevent eviction or foreclosure, secure housing if they're homeless or experiencing a crisis like a domestic violence victim. We can secure or prevent shutoff of utilities related to health or safety, and we can also repair damage to a home if it causes that health or safety risk and it isn't covered by the landlord. And
I do have one other question.
Sure.
Miller says, I have a couple of clients who are single parents and are disabled. Is TANF available to them?
Single parents, yes, absolutely. With each applicant, we look at the person's circumstances. Most recipients of TANF have some sort of work-first activity, but folks that have a disability or incapacity and they're unable to participate in work-first program, we're going to meet with them individually, talk to them about what's going on in their circumstances. We may look at a temporary deferral for things that are more short-term. Somebody has a broken leg or something and they can't participate in activities. Or if it looks like it's going to be a long-term or a permanent disability, their activity might be trying to get on some other source of income like Social Security, SSI, something like that. So yes, absolutely. If they're under the income and resource limit and there's kids in the home, they can look at applying for the cash grant for TANF. Any other questions?
Not right at this moment.
Okay, perfect. So, so for the AREN program, again, this is for TANF recipients who meet some sort of housing utility emergency. They, again, need to be on TANF, the state-funded program, which is the TANF basically, or the Refugee Cash Assistance Program, which I'm going to talk about next. They need to have an emergency housing or utility need, but also be able to meet that need in the future. We don't want to help pay to keep somebody in an apartment when their rent is, $1,500, but their cash grant's only, $568 or something. So we might use that money to help move that family into a place they can't afford. And then they have to have good reason for not having enough money to pay the bills. So if their rent was $89 and the grant was $568, we would want to know, what happened that they were unable to pay for their rent that month. We're always going to try to decide the lowest amount that ends the requirement. So the family might be able to pay a portion of it and we could pay the remainder. We're going to try to connect with the landlord or utility company in order to get information we need to make that decision. And then the payments always go to the vendor themselves. So it's not money put on the EBT card. It's actually a check or warrant mailed to the utility company or the landlord in those cases. And let's see what else would be important to share. And I think just we're always going to look at the circumstances. So if the family has some money put away, for an emergency, obviously, we'd want them to be able to access those resources first, and then us look at maybe helping with the difference. And in households where it's a caretaker relative, typically we wouldn't look at their income for TANF when they're getting a cash grant for the child. But if they're asking for help for paying the household rent or utilities, we would be looking at what other resources might be available, like their income or SSI, which we typically don't look at when we're determining the cash grant. Any questions about the AREN program? All right, I'm going to go ahead and skip to the next one here. So the Refugee Cash Assistance Program, we don't have our experts on that program today, so I'm going to tell you a little bit about the program. But if I can't answer any questions related to this, we might have to take them down and get back to you. The Refugee Cash Assistance Program helps refugees by providing cash and medical assistance, and refugee medical assistance during their first 8 months in the United States. This program is for single or married adults without children. Refugees with children would be eligible for TANF. There's a variety of immigration statuses that could qualify for the Refugee Cash Assistance, or RCA, including people who enter the U.S. as refugees, persons granted asylum, certified victims of human trafficking, Amerasians, Cuban, Haitian entrants, special immigrant visa holders from Iraq and Afghanistan. The DSHS Office of Refugee and Immigrant Assistance also provides a broad range of services that helps refugees and immigrants achieve economic self-sufficiency and integration into Washington's communities. So some of the services that come along with this program are employment and training programs. There's some vocational programs and English language programs, refugee health screenings and mental health services, naturalization services, a comprehensive case management, and then some self-sufficiency integration workshops and refugee school impact grants. So the Office of Refugee Assistance, or ORIA, partners with over 60 different service providers across the state, including refugee resettlement agencies, community-based organizations, local colleges, and other state agencies. Most service providers have close ties to the ethnic communities, and many staff who were former refugees. The services provided are in the individual's primary language and are provided in a culturally appropriate ways.
I do have another question, and it is about AREN. Darren said, is there a limit on how many times you can receive the emergency need AREN, or is this one per 60 months?
It's up to $750 in a 12-month period. So if somebody used up the full $750 once, they wouldn't be eligible to that program again for 12 months. If they used $350 now, they'd still potentially have $400 they can use in that 12-month period. Okay, so if there aren't any other questions, I think I'm going to turn it back over. It might be Nicholas.
Hey, thanks, Sarah. Let me just bring something up for myself here. So I'm going to talk about a few different cash programs. The first one is the Aged, Blind, or Disabled program. We commonly refer to it as the ABD program. So ABD provides support to people who are 65 and older, blind, or determined by us to likely meet federal supplemental security income SSI disability criteria. We have blind in the title, but because most folks who are legally blind qualify for services with Social Security or Department of Service of the Blind, there's only just a very small handful of clients that we have. So the majority of our population caseload is has some sort of a disability or are aged over 65 or older, and those specific folks, the 65 or older folks, typically aren't eligible for SSI due to citizenship roles. Our households don't include minor children. Those those cases would be appropriate for TANF. Potentially, we're a state-funded program. We don't receive federal funding, and formerly ABD was known as General Assistance for a long, long time, and then briefly was also called Disability Lifeline. So that all different incarnations of the General Assistance program. We review applications for ABD first on a financial basis. So people will apply and we'll screen for resources and income and citizenship and social security number and just sort of those basic rules. And then so if someone is determined financially eligible, then they're referred to a disability specialist, some colloquially known sometimes as a social worker, and the social worker will interview them and conduct a disability determination. So we'll request medical records. In some cases, we may pay for new evidence, basically to try to get a handle on what a person's conditions are and how it impedes their ability to work. And we also, when we're making that determination, if someone isn't, we look at ABD first, and if they're not eligible for ABD, we'll determine eligibility for a different program called the HEN Referral program, which I'll talk about in a minute. In terms of being on ABD, some of the benefits include you're approved for a 24-month approval period, so 2 years. There are things that you need to do to maintain that approval. There's reviews of your resources and things like that, and income, and every so often. And we also sometimes have certain program requirements that clients are required to do. But typically, when we approve for a 24-month period. The cash benefit is very small. It's up to $197 for a single adult. We help these ABD clients apply for SSI through SSI facilitation. So we'll help them go through that whole process, file the initial application, help them file their appeals if they're denied at initial level, and go through that entire process. We also, in addition to the cash benefit, ABD clients get a referral to the HEN program, Housing and Essential Needs program. Again, that's just a referral. We don't determine eligibility for rental assistance, or we don't distribute essential needs through the CSOs. That's all done through community providers, and that entire program is overseen by the Department of Commerce. We also do some limited case management and referrals. But caseloads are pretty large. I don't know what the average caseload is for ABD and HEN referral. When I was in the field, it fluctuated. At my lowest point, I probably had 130, and at my highest point, I probably had 400 cases. So there's some case management, but depending on your caseload, you're limited on what you can do and the support that you can provide. In terms of program requirements, there's a few, but sort of the main ones are, or some of the main ones are signing. It's called the Interim Assistance Reimbursement Authorization. So basically, this is an agreement that the client signs, and if they're awarded SSI, they actually have to. The state essentially garnishes their lump sum to repay the grant that we paid through them. That's something in state law that actually helps fund the program. So that's something that needs to happen. And then they are required to follow through with the SSI application. Again, we help with that through a SSI facilitator. And then if there's chemical dependency or substance use disorder that is impacting their condition, then they're required to pursue an assessment and treatment. And in some cases, they may not be. Again, it has to be sort of tied to their condition. So, for instance, if someone has terminal cancer and they have an alcohol use disorder, we're not going to require them to seek treatment for that if it even if they didn't have that disorder, it's not going to impact the disability. So we take that into consideration. Yeah.
We do have a question. Darren says, for individuals receiving ABD, is there an automatic referral to the Division of Vocational Rehabilitation?
There's not an automatic referral, but we do discuss that program at every social service intake. So we kind of introduce the program. We tell them, we just introduce the program and allow them to choose. It's an option, and we make a referral if they're interested. It's voluntary. Just a couple quick stats on ABD. Our statewide caseload hovers around, and some of these numbers might be a little bit outdated, but it's around 20,000 clients. The vast majority of those folks have a disability, so that's about 77% of those clients, and then the folks 65 and older is about 23%. Approximately 37% of the caseload statewide is homeless, so that could be either that's a homeless coding in our system. It could be unsheltered, it could be sort of couch surfing, and about 54% have a mental health illness as their primary disability, and the average age of an ABD client is 51 years old. A couple other things I'll touch on before I jump into the next program. There are monthly income limits to the program. They're very low. So the income limit for a single adult is $339. However, we do offer earned income disregard. So someone, if they're working, because we try to encourage work and invoke referrals when it suits the client, we disregard 50% of any earned income. So let's say someone's making $600 a month. Maybe they're doing some trial work or trying to get back to work. Well, they would still be eligible for the program. Their cash grant might get reduced, but again, they'll still be on the program, have support, be getting that SSI facilitation. We'll still pursue that application, and they're still eligible for the HED referral. So, and then I mentioned we do VOC referrals. We also do foundational community supported employment referrals. Those are automated for all of our HED referral and ABD clients because medically they should meet the criteria for that specific benefit. So we do make those referrals. We screen for veterans referrals when they apply, and there are no support services for ABD, but minus maybe a minimal bus pass here and there to help get them to the office or get them to an appointment. And that is what I have on ABD. Any questions on ABD before I jump to HED referral?
So Whitney Joy says, did you say automatically make FCS referrals?
For supported employment, not supportive housing,
okay,
when they are approved.
And Allison, I'm sorry, go ahead. I apologize.
I just wanted to clarify when they're approved on that program, not when they apply. So once they're approved, they're more, it's not 100% certain, but it's very, very likely that they are eligible for supported employment. And that's a partnership that we have with Healthcare Authority and AmeriGroup, and I can't remember when we kicked that off. It's been a while now, it might be a couple of years.
Allison also says, is there a cutoff point for ABD?
As long as they remain eligible, there isn't necessarily a cutoff point, but typically, someone will either get SSI, or if their health improves, they might go off the program. But there are cases where I just remember when I was in the field, sometimes getting on SSI is, or receiving SSI, I should say, is especially with folks with mental health issues, sometimes that can be challenging. They might bounce on and off the program, our program, and so it can sort of disrupt that process. So, but they can continue to come back as long as they meet our eligibility requirements. But we do review that approval every 24 months on a medical basis.
Jim asked, was it a 50% in earned income disregard?
Yes, earned income. Unearned is dollar for dollar, but earned income is disregarded 50%.
Okay. And then Whitney Joy asked, do they consent to the FCS referral?
Sorry, say that again.
Whitney Joy had asked, do they consent to the FCS referral?
They don't consent to it, but it's not mandatory. So basically, all it is a paper referral. That it's just like our HEN referral. It's when we approve, we'll send them their approval letter saying, hey, you're approved for ABD. Here's your benefits. Here's your approval period. They'll get a HEN referral saying, hey, you're eligible for a referral to HEN. Here's local contact information to get in touch with them. And then again, there'll be a letter saying, hey, you're very likely eligible for for supported employment services. If you're interested in that, contact AmeriGroup. So it's all voluntary.
Okay, and that probably also answers Kelly's question, which was, do they have to prove they're working with an FCS employment case manager? So it sounds like it's voluntary.
No. Yeah, we don't track it. We don't. I mean, I see some data. I think from I can't remember offhand what it is. I know a large percentage of both supportive housing and supported employment clients are ABD or HEN referral clients. I want to say it's like maybe a third of them, like maybe 30% or something. So I know we have a lot of the existing population of folks receiving those services. A significant chunk of them are clients on these programs.
Okay, and that catches us up on questions once again.
Awesome, thanks, Dawn. So if you want to go to the next slide, Sarah. So the Housing and Essential Needs Referral Program, it kind of has a weird name. So this used to be called Medical Care Services, used to be called General Assistance as well, GAU. Back in the old days, GAU was this program and GAX was ABD. So this is a 12-month approval. This is, I should have said earlier for ABD, and that ABD is if you have an impairment that we expect to last 12 months or longer. HEN referral is more of a short-term incapacity where they're expected to have an impairment that will affect work at least 3 months, but shorter than 12 months. So it's a 12-month approval. They get case management and referrals. They receive a referral to HEN. And that's pretty much it. There's no cash grant. So it's kind of a weird thing where we're basically, it's a program, it might be the only program that we have where we're not actually issuing a benefit. We're doing this determination. We looked at ABD, they weren't eligible for ABD, but they still received this referral. So this is a caseload I know currently it's around 4,000. And it's possible half of those folks aren't really, maybe they're accessing essential needs through their local provider, getting, personal hygiene items and things like that. But there's a good chunk of people, I would imagine, on this program that aren't necessarily receiving something.
So Whitney Joy
Yeah.
says RDA, Research and Data Analysis, creates monthly reports that are on the HCA website. So just sharing with folks.
Yeah, for the foundational community supports.
Correct.
I mentioned Commerce administers this program, and they do it via contracts through the Consolidated Homeless Grant. And in some cases, that's directly from Commerce to a provider, or sometimes there's an intermediary there, like for instance, King County. The money goes from Commerce to King County to Catholic Community Services. I mentioned our caseload is currently it's around 4,000. Approximately 50% of these clients are homeless. 71% have a primary mental illness as their incapacity. In relation to ABD, higher homeless population, higher mental illness population, and the average age is at 41 years old. That's all I have on HEN referral. Any questions on that one? Okay, if you want to go to the next slide, Sarah. So ongoing additional requirements. This is a really small program, but good to know about. I don't think it's as known in the community. When I worked in the community, I wasn't aware of it. It's a state-funded program to cover a need beyond essential food, clothing, or shelter that we define as necessary for an individual to continue to live independently. And it's only available to recipients of folks who are either on TANF, Refugee cash, which we already talked about, both of those, pregnant women assistance, ABD, and SSI. So if someone is on one of those programs, they could potentially receive benefits through this program. A social services staff makes this determination, and the benefits that a client may qualify for are restaurant or home delivered meals. That's kind of related to like a disability or their situation, or if they're not eligible maybe for long-term care services that could provide that service. Food for a service animal is another benefit. Laundry services and telephone services. And I mentioned it's a small caseload. My numbers might be a little outdated. The last time I looked, it was around 250 cases, and the vast majority of the cases are for service animals. So about 87% of the cases are for service animal food, and that's an additional benefit that just goes on their EBT card that they can utilize for that purpose. And I can't remember offhand how much that is for service animal food. I want to say it's 30 or 40 bucks maybe.
So Luann has a question and says, can you say again what programs the client needs to be in to get OAR?
Sorry, Don, I couldn't understand you. You were breaking up there.
I apologize. Luann says, can you say again what program the clients need to be in to get OAR?
Yes. TANF, State Family Assistance and Tribal TANF. So those are all kind of TANF related programs. Pregnant Women Assistance, which is a super tiny program. You may have not heard of it. It's basically folks who are pregnant that aren't eligible for TANF. It's like 30, 40 clients across the state. Refugee cash, which we talked about earlier, ABD, and SSI. And if you're interested in kind of knowing where to find more info on that, the Washington Administrative Code, the chapter for it is WAC 388-473.
Thank you.
Yep. And then too, I mentioned sort of some statistics here and there of caseload size and demographics and things like that. There's a public document that I find really helpful, and if you just search online either DSHS briefing book or ESA briefing book, that should pop up. It's a public document that we publish every year with a bunch of data for all of our programs. You can see the caseload side. You can see where the cases are in the state, if they're, by county, by CSO, what the demographics are. So there's a lot of helpful information there that is a resource for folks to check out.
Nick, Darren asks, for individuals who may be voluntarily or involuntarily hospitalized, does OAR provide respite care for a service animal or emotional support animal?
So if they're on one of those programs, we would pay for food potentially still, but not respite care. However, that could be a situation where maybe you could explore like a exception to rule kind of request. So yeah, I would maybe explore that through, if you have a connection with at the CSO, whoever their social worker is there, maybe a conversation there. And I think if it were to be considered, it would have to be considered through that process, which ultimately it would come to me. If for a decision, I'd have to kind of research if we would, basically when we do an exception, we just have to make sure there isn't any conflict with state law. And because this specific program isn't, it really isn't in state law, we have a fair amount of control over what we can do with it. So it's possible. I don't know. We'd have to just kind of research it and take a look at it. But under just current rules, no. All right. So it looks like Yvette's up.
Hi there. So basic food is one of the biggest programs we have in Washington State. We serve approximately 500,000 families in Washington State. Unfortunately, that number is climbing, so we won't have those numbers until next month. But due to the COVID crisis, we'll see an increase to that. But approximately 500,000 families are benefited from the basic food program. It helps families and individuals have a more nutritious diet by adding food assistance to their food budget. So for some people, it's only their food, it's the only food budget they have. But a large majority of the people on this program are employed or working. So it's an additional benefit to their monthly income. So you might hear this program referred to as the word SNAP. That's the federal terminology, Supplemental Nutrition Assistance Program. That's the federal term. So it's not a separate program, it's the same thing, but we refer to it as basic food assistance because we have two types of food programs in Washington State. The first is the SNAP federal qualified program. And secondly, we have a state-funded food assistance program. That state-funded food assistance program serves families that are legal immigrants but do not qualify as federally qualified aliens is the federal terminology. So our state-funded food assistance consists of two distinct groups. So qualified aliens, this is the federal terminology, who have not met the requirements for age, work requirements, or 5-year time frame of being in the United States, or non-qualified aliens who are immigrants that are not eligible for federal benefits, such as marshalees or we used to have a terminology called persons residing under the color of law. So it's people that are here that we know reside here but don't have an official, designation of immigration. So that is a state-funded program. So when it comes to the food assistance, basic food programs and the benefits, people can buy any food except heated ones. So things that you would get that are already prepared or hot are things you cannot purchase with the EBT basic food funds. But I will say we are working on waivers during this time right now with COVID-19. So if that changes in the future, we will let everyone know. But that would be a temporary change. It also doesn't cover cleaning supplies or paper products or pet food. Like Nicholas was talking about, the food purchases, you can't purchase with your normal SNAP funds. It would be declined, but you can use your EBT to purchase normal food for yourself. So you'd have to get that cash payment of the OAR payment to be able to use it for those the service animal food. So sometimes it's confusing for people because they try to use their EBT not knowing that there's a cash account and there's a food account. The food does not allow for that. So any questions on that before I move on?
None on the screen.
Perfect. So I wanted to go over some other additional benefits that people may not be completely aware of that come with being on a basic food program. So no matter the amount of benefits a household receives while active on basic food programs, the household's also eligible for other programs. So we do have a population of 0 benefit eligible households because their income's too high. We have standards that we have to meet. That's the maximum allotment or the maximum income limit for food assistance is 200% of the federal poverty level. So that will vary depending on the household size. So even people with a $0 allotment may receive these services. So some of those services include reduced rate telephone and internet services, free and reduced school meals for children, basic food employment and training program, BFET, an employment pipeline, which I'll discuss a little bit more in the next couple slides. And then we may authorize benefits for food for a service animal, like Nicholas was talking about. So these are some of the things that people may not be aware of, that being on basic food opens the doors to other eligibility with other resources. Also, I wanted to mention currently, Washington has been piloting an online purchase program where those with an EBT card and food assistance may purchase food online through Amazon and Walmart or Walmart. So that is an option for those during the COVID-19 crisis. We actually started implementing that pilot prior to the shelter in place order. So this is relatively new, but also expanding. So whether or not more stores get included, or you know, where people can purchase online, right now it's just Amazon and Walmart. Those are the main other benefits. Any additional questions on this? Straightforward. Okay, thanks. Okay, next slide. So I wanted to go over a little bit the basic food education and training program. So basic food does have certain work requirements for households that are not considered exempt. So some households would be exempt from work requirements to keep their food open if they're disabled or employed or in a state or local employment and training program. So we determine that the individual has to work based off of the interview with them and determining their circumstances. So one of those populations that people may have heard of is the able-bodied adults without dependents. Those are individuals that are adults without a dependent in their home, and they have to have some kind of participation in employment activities to maintain their food assistance. I will say at the time being, because of the COVID-19 crisis, and we'll talk a little bit more at the end of this as well, it's an evolving situation. So we are exempting our, or giving our ABOD population good cause right now for not participating. But I wanted to give you some resources once this is over, that if somebody is identified with as an ABOD, able-bodied adult without dependent, and they don't have an disability or not already participating in employment and have to do some kind of work requirement, an option for them would be also basic food education and training. So this program is available to people that are age 16 or older, able to work 20 hours a week or more, and not receiving TANF. It is a voluntary program, but if they're considered an ABOD, this would basically meet their requirement for work activities. The program offers employability assessments to identify barriers to a living wage job, case management to help with participation and access and resources, basic and vocational education. This education focuses on providing the necessary credentials and qualifications for a livable wage, job search training, job search and job retention. So they have lots of resources. This is just another one for them to access if they feel that they can do that. We also offer, if somebody's participating in this BFET program, we offer housing assistance, transportation assistance, work clothes assistance, tools. We will pay for maybe books and school supplies, tuition assistance, and childcare. So it's not all providers offer all these supports, but can happen depending on the person, and these are provided on an as needed basis for the participant to remain engaged in BFIT activities. So we offer BFET services through our contracted providers. These services will be different based on the provider's expertise and location. And we currently have 34 community and technical colleges that provide basic education and vocational education, 10 refugee and immigrant community-based organizations providing employment and training services designed to help those refugee and immigrant participants, and 40 community-based organizations providing employment and training services. So if you're interested in more information, there is a link there, dshs.wa.gov for BFET, or /BFET. Any questions on BFET? You guys are making it easy for me, thanks. All right. Employment pipeline is just another service that we wanted to highlight really quickly. So employment pipeline is a program that it's kind of similar but different from the BFET and workforce program. So it's different because we want to help families and individuals to become self-sufficient by connecting to participants within the program to gainfully employ for gainful employment opportunities, as well as providing support to participants for the job to be job ready. So where it's different is it provides regional navigators who offer one-on-one assistance to each participant enrolled in the program. Navigators have the ability to provide this one-on-one activity outside of a local community service office. Along with job readiness assistance, the navigator can access a participant's case information for ER or eligibility review or mid-certification review completion in the field. They can provide referrals to their workforce development partners for the participant to get information about local employers, and they can assist the client in locating educational and training opportunities. So a little more hands-on development here. So you know, just another access point for these participants on our basic food programs to become self-sufficient and find employment. So,
Darren has a question.
Any question?
Yeah.
Sure, go ahead.
Darren says, if a candidate has outstanding student debts or loans, how would that impact BFET participation?
My understanding is it won't, but I can follow up just to ensure with our BFET team. We have a team that works on that, but since the funding is separate than a normal unsubsidized loan or, you know, the normal things that people go through, I believe that it should not, but I can follow up with Darren. Good question.
I think I'm up again. Just something I thought of adding as the questions were coming in for the TANF workforce program. There's funding for schools, so if someone doesn't qualify for financial aid, there are workforce dollars that are used for the school program, and workforce participants could potentially engage in the employment pipeline program as an extra way to get assistance with trying to find employment in the areas that it's offered. We wanted to take some time to just kind of go over the child care subsidy program. Child care subsidy used to be part of CSD, but as of July 1st of last year, it's actually moved over to the Department of Child, Youth, and Family Services. So there's a new phone number to reach them. And it's the phone number you see listed at the top there, 844-626-8687. I believe if you still call our contact service number, there's still an option to press for childcare, and for the time being, it will still divert folks over to the childcare Working Connections childcare program. But the program itself is offered to eligible households with parents who are working or participating in DSHS approved work activities, and those who meet those whose children meet citizenship requirements. There's also a seasonal child care program that pays for child care subsidies to eligible seasonal employed agricultural families who live in designated counties and are not receiving TANF benefits. So it can be extended for folks on TANF as well. Working Connections Child Care and DSHS can help with licensed or certified child care centers licensed or certified family child care homes, relatives who can provide care in their own homes, or adults can come to your home and provide care as well. So for more information about the child care program, you can look at WAC 110150001 for additional information. Just to point out, work first activities for folks on TANF and BFET activities could potentially qualify for help with child care assistance. All child care providers must pass a background check, criminal background check, and provide a valid Social Security number, which verifies authorization to work in the U.S., a valid picture identification with current address as well. And then it's important to note the Department of Child, Youth, and Family Services sets the policies and determines eligibility for Working Connections Child Care and Seasonal Child Care Program. So we just wanted to make sure that folks knew that this program was here, and it provides services for a lot of our programs, but it's now part of another department.
Sarah, this is Nicholas. I have a quick question I'm not sure if you know the answer to. Do you know, when I was in the field, the certification periods were 12 months. Are they still 12 months for TANF folks?
Yes. So when somebody qualifies for child care, they're set up with a 12-month eligibility process. So potentially someone who ends up they no longer participate in a work activity or work first activity, they keep their eligibility for the child care. The reasoning behind that is that it keeps some stability for the child as the parent is fluctuating through different activities. And I know that there's a lot of different work going around this current crisis to try to keep child cares open, even if the parents aren't able to bring their kids there. But I can't really add a lot to that. You might actually have to go to the Department of Children, Youth, and Family to find out more about what they're actually doing to support families and providers during this time.
Cool, thanks. So like
Sure.
if someone, let's say if someone was on TANF 13 months, they would have already gotten approved for their subsidy reapproved for another year, so they'd essentially have 24 months of subsidized child care, even though they were only on TANF for 13 months. Is that accurate?
Correct. So yeah, if they start at the 12-month mark and they are recertified, they get another 12 months, even if the family was off TANF in that time. But normally, under normal circumstances, I'm not sure what they're doing for the COVID, if their review comes up and they're no longer working or no longer in a BFET or work first activity, then they wouldn't meet those working criteria, approved activity criteria. But I think they're trying to make some exceptions right now.
So we have a question. Will physical therapy count as a workforce activity goal towards rehabilitation to go to work to get child care assistance?
I don't know the answer to that. I don't think so. I know that we've had some folks who were trying to get help with child care to participate when they're not on TANF anyway, to participate in an activity that would, I think it was substance abuse treatment, and that didn't meet the work criteria at the time. But they've been another agency for almost another year now. So I would really encourage folks to try to connect with them. I would say that if they're on TANF and we put it into their work first plan, into their individual responsibility plan, it will be covered for child care. So if we're asking them to work with Division of Vocational Rehabilitation, for example, then those activities would be included in their IRP and therefore covered by the Working Connections Child Care. Sorry, I wish I knew more about this program, but I think that they're doing a lot of changes right now and to respond to the COVID, so there might be some exceptions that I don't know about. Any other questions before we move to the next slide?
None on the screen.
Okay. So I'm going to go over what we're currently doing for the community services offices. This has changed due to the home stay safe order. So we'll talk a little bit more about what's currently available at the CSOs. Where, when, and how do clients access services? Well, there's a lot of ways. The local community services offices, or the CSOs, are, there's also the statewide customer service contact center, the phones, and then a mobile CSO. And then folks can access applications and information on WashingtonConnection.org. So first, we're going to share a little about the community services offices. Typically, normally, the office hours are Monday through Friday, 8 to 5. Interview hours are Monday through Friday, 8 to 3 for new applications and reviews. Customers can apply for benefits and submit documents or report changes in the office. Customers can also access the Child Care Subsidy Program through the phones or through the online computer terminals located in the lobby. So if they come in asking for help with child care, we can direct them to the phone or a computer they can do that with. And then they also can connect with their Work First and social service case managers that are located in the offices. We're going to go a little bit more into what is currently being offered with the CSOs here at the end of the presentation. Any questions about this piece? Hearing none, moving on.
So for the access to the call center, so we do have a robust community service call center. The number is on the screen. The same hours as the CSO functioning for phone and interviews. I did want to add in here that we are currently doing telephonic signatures for applications over the phone. This is something that we were planning on doing and was expedited because of the COVID-19 crisis. So if somebody is applying, they don't need to have the physical application anymore. They can call the number and wait, and then they will be routed to a designated queue to do an interview. I will caution right now that our call lines are very full right now, so wait times are longer than we have normally had, and that's because of the COVID-19 crisis and people calling in. So the call is not just for interviews, it is for reviews, eligibility reviews, changes, inquiries, all of that. So patience on the phones is very necessary right now, unfortunately. Okay, yeah. Any questions? No? Okay.
Sorry, I may have jumped again on that slide. I want to tell you guys a little bit more about the mobile CSO, but right now it's not running due to the stay-at-home order. So, but we wanted you all to know that there is this service usually available. The state has reinvested some funds for high performance federal bonuses. So we got some bonuses for doing well, and some funds through the Gates Foundation to make a service delivery strategy reality in 2010. So there's 2 separate vehicles that are each designed to be fully functioning CSOs, and each one of the mobile CSOs focuses on unique needs of its geographical areas to provide services statewide. So to improve participation in basic food participation by providing services at locations where DSHS representatives don't usually have a presence, like remote or rural areas of Washington, some islands that don't have a CSO, they can be up there and people can come in and apply, do the reviews, ask questions, report changes. There's experienced staff that are there to provide those services. They can also reach out to partners, sometimes such as Division of Child Support, Division of Vocational Rehabilitation, or other local community service agencies to offer the mobile CSOs at events. They've also gone out to places where our offices have experienced some sort of inability to offer services. There's flooding, there's some sort of issue with the office itself. So this mobile CSO can pull up there and continue to offer services during that time. I'm not sure what else I want to share about this piece. In a disaster, for example, as well, the mobile CSO can go out to the area that's experienced disaster if there's wildfires or flooding in one particular area to continue to offer support to the people where they wouldn't have to do quite a bit of traveling to get services. And it's self-contained, so it's got its own generator, power supply, cellular connections, and backup satellite for connectivity. So they're pretty cool when we have them running. Any questions about the mobile CSO? All right, so we're hoping those will go back up and running when the crisis when we run it. Questions of the next year.
So Walk On Washington, basically this is just our online portal to
Hoping those will go back up and running.
Benefits and report changes, complete reviews. So this is available 24 hours a day, 7 days a week. Excuse me. There's also there's a CFI qualify feature on the website that can kind of let folks know what programs they may qualify for. There's also other tools on the site for community partners to apply for benefits or report changes on behalf of their customers. There's a public access directory where you can search resources, community resources, and also a client benefit account. So clients can sign up for a CBA client benefit account, and you can use that portal to pre-fill your review forms. You can also access your benefit amounts historically up to the past year. Check the status if you've applied of a pending application, and your documents to see they've been received, things like that. So there's I'm sure a lot of other things that I didn't cover with the CBA, but just a handy tool for clients to be aware of and partners to be aware of the site. Any questions on Walk-On?
There is a question that Crystal Bauman had. Does the mobile CSO have the same hours as the offices? So I don't know if Sarah has information on that.
Hi, I believe so, but I don't know 100%. Let me scroll down and see if it's actually in here. I don't know, but I'm going to give you a website to go to. I believe so. I believe it's 8 to 5 typically. I would imagine that there might be circumstances such as an emergency where they could flex those hours, but I think typically it's 8 to 5. But the website you can go to learn more is www.dshs.wa.gov/mobile office. And it'll probably tell you right now that we are closed. This is not currently available, but I bet they normally work with normal hours.
And anecdotally, when I've worked on the mobile CSO, if it was for a specific event, we would advertise to that specific event's time, and that would be, so it wouldn't be the normal 8 to 5 if it was just a outreach event that was supposed to be for 4 hours. So that would be where we could alter the time, but that's my anecdotal experience being on the mobile CSO.
Thanks, Yvette.
No problem.
I've actually been on the mobile CSO, so very cool.
Mm-hmm. Oh, and then there is a question with Lisa. She said, how can we get the mobile unit scheduled in the communities?
So you can do that by you can read
on that link. I think it might.
So here's some information on how to schedule an event here on the website, that mobile office website. Looks like you can contact them by email or phone or regular mail. And Javier Ruiz is the administrator for the mobile CSO. So there's a link to his direct email as well. Any other questions about the mobile CSO before we move to the next topic?
Nothing on here.
Okay.
And I did, I'm just Skyping with Josie, who used to be involved with the mobile CSO, and she said that it can run outside of 8 to 5 hours. I don't have details on, you know, if that can be Saturdays, or I'm Skyping with her right now. So if I get more info on that, I'll share.
Perfect. Thank you, Nicholas. So we thought we'd take some time to talk about some temporary changes that are related to the COVID-19 pandemic. And some of them are, you know, changing what services we offer in the local offices, but also some changes to make it easier for Washingtonians to access our services. If hopefully this link works. So the community services offices, full services are available through phones. So we're encouraging people to call in to do, to apply, report changes, ask questions, that kind of thing. And they can apply for, do their eligibility reviews without filling out a paper or online form, complete interviews for benefits, get information on their cases, complete a mid-certification review. They can ask to get a replacement EBT card or reach their workforce case manager, or I guess a workforce case manager or social worker. There are still a few services that are available in the CSOs for a limited number of customers to pick up. So in some cases, we can do an EBT card in the local office if the individual has general delivery mail services. And for certain expedited food recipients, all other EBT cards are going to be mailed through the vendor or through the local office program. And customers don't have to go through us to replace their EBT card. They can actually call this number on the website. And then there's some emergency services when mailing isn't an option, that we can have a scheduled time to have folks come in and meet. So we linked again to the Washington Connection org, where people can complete an application online or find more information about resources here. So most of our offices, I think the doors are locked and they're trying to schedule times for people to come in and pick up their EBT card, or perhaps a voucher for workforce support services. And then this, as soon as the orders are lifted and we get the word, we can go back to maintaining the services that we had in the past. Are mailed to them. Okay, so I'm going to go a little bit. I'm not sure if that. Do you feel comfortable talking about some of the AVOD changes?
Sure. So when it comes to the able-bodied adults without dependents, as I said earlier, normally ABODs, what we refer to, would have to do a work activity or employment activity to continue receiving food assistance. They have 3 months to basically, if they're not meeting that requirement, they have 3 months before they're potentially disqualified from food assistance. Right now, we're extending good cause for those able-bodied adults. Originally, there was supposed to be a expansion of the counties that we were going to require residents to do work activities through a federal regulation change. That has been put on hold. There's an court injunction to halt that from happening due to the COVID crisis. So at this time, all the residents in Washington State are exempt from these ABOD requirements, except for King County, and those residing in King County are being deemed as having good cause for not participating for the months of March, April, and May. So they do not have to be seeking employment or a employment activity during that time. We are waiving that, or good causing that at this moment for King County, and that may change in the future once things stabilize. But at this time, that's the circumstances.
And there's some similar changes to the TANF Work First program. Starting March 16th, Work First staff are temporarily suspending the Work First sanction, reduction, and termination penalties with concerns surrounding the COVID-19 pandemic. So while normally individuals who are families that are receiving cash assistance for themselves as adults would be required to participate in Work First activities, but under the circumstances, it doesn't make sense for us to be requiring people to go out and participate in a work activity. So we're still offering voluntary services if folks want to continue in a school program or continue to look for work through online services through WorkSource. They certainly can continue those activities, but we're not taking any negative action against individuals who are unable to participate due to the COVID pandemic. So we're also looking at a good cause. We're saying that they aren't able to participate, but they have a good cause reason not to. And so we're not terminating anybody or reducing benefits due to sanctions. And those that need to reapply for TANF and were in sanction before are not going to come back on TANF in sanction. They kind of get a clean slate, and then once the pandemic ends, we'll start trying to re-engage everyone so they can get back into an activity to try to help them find employment. Another piece that we used to require in the office was a Work First orientation. Individuals would come into our office, usually in groups, and we would tell them all about the TANF and Work First program, some of the opportunities and the requirements that come along with that program. But we are doing those individually now instead of groups over the phone with applicants. So if somebody applies for a TANF, we're going to do an orientation with them over the phone, and then they'll meet that criteria and won't have to come in. We're also looking at suspending home visits for teen living assessments. There is a law that says that a teenager, a teen parent who's applying for benefits, we need to determine if they're living in a safe environment. And typically that meant we actually went out to their home to see who they're living with and what the circumstances are. But for safety reasons, for our folks and those households, we're conducting those over the phone. So we're actually talking to the teens and who they're living with before we can make a determination if they meet the criteria for a teen living arrangement. Some of our activities that folks do for Work First are paid work experience programs. There's community jobs programs through the Department of Commerce, and work studies available through the community and technical colleges, where our participants are actually in a job, they're getting paid, but all those providers are not actually offering a paid site at this time, but we are continuing to pay individuals who were in activities before those closures began, so that even though they can't go to work, they're still getting their paychecks if they are continuing in school in spring quarter, or if this was still their regular 9 months of a community job placement. And there's another, I think Yvette, you already mentioned the injunction about ABODs.
Yes, yeah. There is a question regarding food that I think could segue into the next topic, unless there's other questions about the Work First participation. Okay, so Lisa Hamilton has a question for folks that lost their job due to COVID but had an upper income at that time and now they have no or little income. Can they apply for food programs? Definitely. I want to say yes. And I think that that segues well into the supplemental funding for basic food recipients. So we have received the Food Nutrition Services, so FNS, the federal government has allowed us to give everyone the maximum allotment for their household size in the month of March and April, regardless of their income. So in essence, if somebody wants to apply now, they should, because they will get the maximum allotment for their household size. We have an example in here, but I'll give you another example. Normally we prorate benefits from the date someone applies. So if someone applies today and we can confirm that they recently lost their job because of COVID, we will go ahead and approve it from today's date. So they would normally get half a month's benefits prorated. Well, with this waiver that we were approved for, it allows us to give them the full amount, and they will receive $194, which is the maximum for one person, instead of receiving prorated benefits. And that applies to also households that are still working. So if somebody's normally receiving a zero benefit because their income is high, or a $16 benefit, they will receive the difference. They will receive a supplement. So that supplement went out on April 4th. We're continuing it through the month for new applications in the month of April. We are requesting a waiver for May and June, so this may be extended. But on April 4th, a lot of households saw an extra supplement for March and April on their EBT cards, which we believe will be very helpful for them. So if somebody hasn't seen a supplement on their card, it's either because they already received the maximum allotment for their household size. But if they don't already receive the maximum for their household size, they will receive their April benefits on their regular benefit date. We put food assistance on cards on a random date for each household from the 1st to the 20th. So if somebody normally receives their food assistance on the 15th of each month, they will receive the supplement on the 15th of April. So that is something that I wanted to emphasize. So yes, have people apply now. We are doing the interviews over the phone. They will qualify for the maximum allotment for the month, regardless of income coming into the households, as long as we deem that they're eligible in the month of application. And hopeful that we can do this in May. So the first step is, if people can't get through the phone to do their interview, telephonic interview, get them online. Get that paper application submitted or the online application submitted through washingconnection.org. Get that done, because we go from the application date. We don't go from the interview date. So somebody can apply and be interviewed in 2 weeks, and then we will go ahead and backdate it to their application date if we deem that they're eligible. So this is hopefully going to be very helpful to a lot of households out there not receiving the maximum allotment. We did request a waiver to just give everyone an additional max allotment, but FNS has told us no, we have to bring everyone to the maximum allotment for their household size. So here's the information, and we've also sent out information on Facebook and Twitter regarding this to try to get the word out. So I don't know if anyone has questions about the supplemental SNAP benefits that we've issued. Oh, and people are not expected to repay these. These are not subject to recoupment or repayment. So this is for people to use during this time. And there's no resource limit for food at this time. I just wanted to mention that as well. Food assistance, we only look at income, the income, like I said, at 200% of the federal poverty level based off of the household size. So I think I have an example here. A one-person household can make up to $2,127 to qualify for food assistance. So that's a 200% gross income. So that the higher your income goes, the less food assistance you receive. But in the month of March and or April, that individual would get the full 194 some way or another. So we have 4 minutes left. Thank you.
Is it my turn? Yes.
Yes.
I'll just spend just 2 seconds on it because I want you to talk about DCAP. So basically, we've made some changes to ABD program to establish good cause. We're essentially just trying not to close cases down due to at this time that we've extended some of our review rules, etc. Medical, similar thing. They've extended some of their certification periods and aren't closing medical down at this time unless I think the client requests a termination or they move out of state. There might be another reason in there I'm forgetting, but I want to pass it back to Sarah so you can talk briefly about DCAP.
Okay, great. Governor Inslee issued the state of emergency in Washington state and also mandated that we issue a disaster cash assistance program. The disaster cash assistance program has typically been used for a natural disaster, but we are using it for this pandemic so in order to help people who are affected by loss that they've experienced due to the pandemic. And the loss could be a loss of income. They are no longer able to go to work. They had their hours were cut. They can't leave their homes, or they can't look for work at this time. So it's a disaster cash program that's meant to help people who are not eligible for our other cash assistance programs. So if a family was eligible for TANF or diversion, we would look at those programs instead, because the disaster cash assistance is a 1 month help in a 12-month period, and those other programs are ongoing. The disaster cash assistance program, when the applicant applies, it's actually open to more people than other programs in the fact that they don't have to have a child or a disability in order to qualify for the cash assistance program. And there's also no requirement that they meet a certain citizenship or immigration status or social security number status. So folks who were working and no longer able to work but didn't meet those criteria can still potentially qualify for the disaster cash assistance program. We're going to look at the need of the income limits actually match the TANF payment standards. So it's a pretty low income limit, but at this time, there might be folks without any income that might need to apply for this program. We look at their need for the individual. So we can look at their housing needs, their utility needs, household maintenance items like cleaning supplies and personal hygiene, and then issue benefits based on that. The benefits would, the maximum benefit that a household could receive matches the TANF payment standards. And the benefits could be issued on an EBT card for the family to be able to use that. And again, it's only available once in a 12-month period for the applicant. And at this time, it's we don't have an end date. The program will end when the governor ends the state of emergency. So this program actually begins tomorrow. And we haven't issued any public information yet because we didn't want people applying for it early. When somebody applied for cash today, we couldn't look at the disaster cash assistance program. We can only start it tomorrow, the 17th. So,
Sarah?
Yes.
Just let you know, we're at 10:01. So we're, no, it's okay.
So,
and then
really quick.
Yeah, go ahead.
Does it have any questions about the program?
I don't see any.
Okay.
And then just a message from Dawn that she's having audio difficulty, but she wanted to say thank you for all those that attended. And thanks to Sarah, Nick, and Yvette for presenting.
Well, thank you, everybody. Hopefully this was helpful. You can reach out to us with questions as well.
We appreciate it. Thank you guys for letting us do this.
Yeah, thanks. Stay safe and have a great day.
Thanks, everyone. Bye.